Documenting notes for each patient is a very important part of your work at ATS. All notes must be submitted to the ATS office by midnight on the day of the visit. ATS does employ physical, occupational, and speech therapists. While there are differences in the type of documentation for each discipline, the main information required will be applicable to all disciplines. We will begin this video by showing how to properly document regular visits for a physical therapist. To document notes, bring up Hotbox. You will see a list of all patients with the visit type next to it. Under the appropriate date, find the patient's name whose note you are wanting to document and then choose the visit to open the note. When you open the visit, you will see the visit type in the top left corner. Please make sure that the visit type is for the correct discipline and is scheduled appropriately. For example, if you are a physical therapist assistant, make sure the evaluation scheduled is for a PTA visit. If you are a licensed physical therapist, you will want to be sure you are scheduled for a PT visit. Below the visit type, you will see the patient's name. When documenting, be sure to always confirm the patient's identity, then check the box next to Patient Identity Confirmed. The next thing you will see is the time in and time out. The time you're in a patient's home doing a visit must be documented correctly using military time. The minimum time for a visit is 30 minutes. It is not acceptable to have a visit that is less than 30 minutes. For patients who have Blue Cross Blue Shield insurance, the visit will need to be longer. Specific times will be documented in the details as well as in your special notes given to you at orientation. Next, you need to make sure that all your dates match. Choose the visit date, then make sure it matches your signature date at the bottom. You also must be sure to check the patient's chart to make sure that your visit date is the same as the scheduled target date. If the dates do not match, please change the incorrect date accordingly. If the patient is homebound, check the box beside Yes, and then note why the patient is homebound. You always need to list the reasons why the patient is homebound. If the patient does not appear to be homebound, please notify the ATS office as well as the patient's home health agency to inform them of the situation. Please wait to document that a patient is not homebound until you have notified the home health agency. Next, you will see a place to document patient vital signs. Refer to the notes given to you at the time of your orientation for those agencies that require vitals as well as the parameters for those agencies. The subjective evaluation for a patient will then be an important part of your note. Your subjective must change each visit and must be relevant to the patient's therapy. You will then note the pain assessment. Document where the patient is experiencing pain as well as the pain intensity. If the patient is not experiencing any pain, please check the box next to No Pain Reported. You must note pain for every visit or your note will be sent back to you for correction. Under Objective Evaluation and Training Interventions, please be sure that you are maintaining true FEM scores and that you update gait training. Be sure to indicate the patient's current status. You also want to be sure to note balance for the patient. Next, you will note the training exercises. You must give a descriptive view of what was done for that visit. Under Assessment, you will see HEP, Safe Transfer, or Safe Gait. At least one of these must be addressed each visit. Progress to goals must then be noted. The section Progress to Goals indicated by and Needs Continued Skilled PT to address must be noted, as well as any functional limitations. Plan and care coordination must also be addressed for each visit. Please note that you do have the ability to save your note as a template. When you use a save template, the information will pre-fill in the note. While this is a helpful tool, it does not mean that it is acceptable to submit the same information for each visit. Your subjective must change from one visit to the next. You want to be sure that the patient's progress is clear when you are documenting, so your notes must change to remain current to the patient's status. You must change the information as the visits progress, otherwise your notes will be returned to you for correction. When you are finished documenting, you can choose to save the visit to complete at a later time by choosing Save. If you are ready to submit the note, you can do so by putting in your electronic signature along with the signature date. Again, Be sure the signature date is the same as the visit date documented at the beginning of your note. Once the signature and date are input, you can then choose to submit your note to the ATS office. If you are an occupational therapist or certified occupational therapist assistant, you will be documenting different types of treatments, which can include bed mobility training, transfer training, motor coordination training, self-care training skills, instrumental ADL training, cognitive status and perception training, and fall risk and functional testing and related training. The general rules for documenting a note remains the same for both disciplines. Subjectives must change, dates and times must be recorded correctly, and the notes need to show patient progress towards stated goals. If you have any questions regarding proper documentation, please contact the ATS office. The next video will cover reevaluations for therapists.